Hi everyone, my name is Zephaniah Chong, a USM Masters in Science Clinical Exercise Science student. This is a video assignment that I have prepared to share with everyone about functional exercises. More specifically, functional exercises for people recovering from an ankle injury or ankle surgery. I hope all of you will find this video informative and also feel free to like and share this video. We begin with a simple explanation on what is functional exercise. Functional exercise is a broad term for any form of exercises that aims to improve daily function. These exercises can be categorized into locomotion, level changes, pushing, pulling, and rotation. Ankle sprain is quite a common occurrence. It happens when there is a forceful stretching of our ankle ligaments beyond its limits. The two common ankle sprains are inversion and eversion sprains. When ankle sprain occurs, the immediate treatment that can be given is based on this mnemonic. P. Protect the injured area to prevent further injury. R. Rest. Do not try to forcefully put weight on the ankle. I. Ice. To control the inflammation and reduce the pain. C. Compression is to use compressive bandages like elastic wraps to minimize the swelling and also to provide support to the injured joint. E. Finally, elevation, which is to reduce the pooling of fluid in the ankle and foot. As for training, strengthening and regaining good function of an injured ankle joint, functional exercises can be done, but only when there is no more swelling and no more pain during weight bearing. The four ankle movements are plantar flexion, dorsiflexion, inversion, and eversion. Again, plantar flexion, dorsiflexion, inversion, and eversion. We begin with some warm-up exercises. The first warm-up exercise is to perform plantar flexion and dorsiflexion repetitively. This movement is also called ankle pump exercise. This can be done for at least 30 to 50 repetitions. Our next warm-up exercise is to perform clockwise and anti-clockwise movements with our foot. This exercise is also called ankle circumduction exercise. The first stretch is to stretch our calf with the help of a towel. This position is held for at least 30 seconds. The next stretch is done in this position. This is to stretch our tibialis anterior, or also known as our shin muscle. This is held for at least 30 seconds. Now we begin with our strengthening exercises. The first strengthening exercise that can be done is called seated calf raise. This movement is done for 10 to 15 repetitions. It can be done without weights or with weights. The next exercise is standing calf raise or tiptoe. This is also done for 10 to 15 repetitions and can be done with the support of a chair. As a progression, you can do this exercise with the support of only a stick. It is also very good to perform this exercise without any support. And finally, the standing calf raise is done with weights. Our next set of exercises are categorized as single leg exercises. We begin simply by just standing on one leg with the support of a chair, then support of a stick, and finally standing one leg unsupported. Once you are able to complete this, now you can move on to single leg calf raises. This also can be done with the support of a chair. If you can complete single leg calf raises with the support of a chair, you can then move on to single leg calf raises with the support of a stick. You can then progress to doing single leg calf raises unsupported. For more challenge, you can then do single leg calf raises with weights. The final exercise is to stand on one leg while doing other activities. You can do any activities that you like or follow my example in the video. The next exercise is stability exercises. The first exercise is to stand on one leg and reach forward while trying to maintain balance. Next is to reach forward and then bringing your knees towards your chest while maintaining balance. Now we move on to standing on one leg while reaching your foot sideways, as far as you can while maintaining balance. The next variation is to move your foot forward as far as possible to the front while maintaining balance. If you find it difficult to perform any of these movements, you can also do it with the support of a stick. This next exercise is a challenging one, even for those who do not have a history of ankle injuries. It is important that while performing all four directions of the movement, you do it as slow as possible while maintaining balance. Like the previous exercise, if you're having difficulty in balancing, you can also use a stick as a form of support while you perform all four directions of exercise. The next exercise is a forward hop. You perform the forward hop with one leg while trying to maintain balance when you land. This exercise is followed by lateral hops, or also called as ice skiers. It is important that you maintain balance and do not rush through this exercise. The next set of exercises is done with the help of a stability ball, or also called as Bosu ball. We begin with the simplest form of Bosu ball exercise, which is to step up, balance, and then step down from the Bosu ball. It is normal if you feel unstable or wobbly in the legs when you first use the Bosu ball. Stepping up to a Bosu ball with one leg and balancing is a difficult exercise, even for those who do not have ankle injury or ankle pain. So do not rush yourself, be patient and practice. The next exercise is to step up on the Bosu ball sideways and to balance with both feet. Now for the tougher exercise. Stepping up sideways on the Bosu ball and balancing with one leg. This is a difficult exercise, so remember, be patient and practice. If you are able to complete all 4 stepping exercises, now you can move on to jumping or hopping onto the Bosu ball. We begin with jumping forward and landing with one leg while balancing on the Bosu ball. Then we hop sideways and balance on the Bosu ball with one leg. Next is to balance with both legs on the Bosu ball while doing other activities. Like me in this video, I'm throwing and catching a ball. The final exercise may be the toughest one in this video. It is to balance on a Bosu ball with one leg while doing other activities. Thank you for watching my video. Hopefully you find this video informative and also have the time to try out these exercises yourself. Most importantly, stay safe and also stay active.